Hello everyone, today we're going to talk about something truly life-saving, how to recognize the signs of a heart attack. Heart disease remains one of the leading causes of death worldwide, but timely recognition of symptoms can make the difference between life and death. Understanding these signs can empower you to act quickly and potentially save your life or the life of a loved one. When we talk about heart attacks, the most common and recognizable symptom that people think about is chest pain or discomfort. It's something that many associate immediately with a heart problem, and for good reason. This sensation is often the body's way of signaling that the heart muscle is not receiving enough oxygen-rich blood. But what exactly is this chest pain or discomfort, and why does it occur? The heart, like any other muscle in the body, requires a steady supply of oxygen to function properly. This oxygen is delivered through the coronary arteries, the vessels that wrap around the heart and supply it with blood. When one of these arteries becomes blocked or significantly narrowed, usually because of a buildup of fatty plaques or a blood clot, the flow of blood is restricted. This reduction in blood flow is called ischemia, and it causes the heart muscle to become starved of oxygen. The sensation we experience as chest pain or discomfort is actually the body's alarm system going off to alert us to this dangerous lack of oxygen. This pain is usually described as a pressure or tightness, sometimes as a squeezing or fullness in the center of the chest. People often compare it to the feeling of a heavy weight pressing down, or a band being tightened around their chest. It's important to understand that this sensation doesn't always come as sharp or stabbing pain. For some, it may feel more like a dull ache or a mild discomfort that is difficult to pinpoint. The pain can last several minutes or may come and go intermittently. It's not uncommon for people to dismiss this as just indigestion or muscle strain, but it's crucial to recognize that chest discomfort in this context can be a serious warning sign. Another key aspect is that chest pain related to heart ischemia typically occurs during physical exertion or emotional stress. When the heart needs more oxygen, such as when you're climbing stairs, exercising, or experiencing anxiety, the restricted arteries can't keep up with the demand. This mismatch between oxygen supply and demand triggers the pain. In some cases, chest discomfort can even occur at rest, especially if a clot suddenly blocks an artery completely, causing a heart attack. People should be aware that the exact location and quality of chest pain can vary. It often centers behind the breastbone, but can spread to other parts of the chest. Sometimes it radiates to the shoulders, arms, neck, jaw, or back. The pain may also be accompanied by a sensation of heaviness, tightness, or burning. Unlike pain from a muscle strain or acid reflux, this kind of chest discomfort usually doesn't change with breathing, movement, or position changes. One thing to keep in mind is that chest pain is not exclusive to heart problems. There are many other causes of chest discomfort, such as gastroesophageal reflux disease, GERD, anxiety or panic attacks, lung conditions like pneumonia or pulmonary embolism, and musculoskeletal issues. However, chest pain or discomfort that is new, unexplained, severe, or associated with other symptoms, like shortness of breath, sweating, nausea, or dizziness, should always be taken seriously. The reason for this caution is simple. The longer the heart muscle goes without adequate blood flow, the more damage occurs. This damage can lead to heart failure, arrhythmias, or even sudden cardiac death. Acting quickly when you recognize chest discomfort that could be related to a heart problem is critical. Calling emergency medical services and seeking immediate care can save heart muscle and lives. It's also important to recognize that the experience of chest pain or discomfort can differ among individuals. Women in particular may have more subtle symptoms that do not fit the classic description of crushing chest pain. They might feel more pressure, tightness, or aching, or symptoms like nausea, fatigue, or jaw pain. Older adults and people with diabetes may also present with atypical symptoms, sometimes describing the pain as indigestion or simply feeling unwell. This variability is why education and awareness are vital for everyone. Understanding the physiology behind chest pain helps empower patients and caregivers to respond appropriately. It's the body's distress signal, indicating the heart is struggling. Recognizing it early means getting the right treatment sooner, whether it's medications to dissolve clots, procedures to open blocked arteries, or lifestyle changes to prevent progression. In conclusion, chest pain or discomfort in the context of heart disease is a complex but crucial symptom. It's the heart's way of telling you it's not getting enough oxygen and that immediate attention is needed. By learning to identify and respect this warning sign, we can improve outcomes and save lives. But remember, chest pain is just one piece of the puzzle, and it's important to consider the whole clinical picture when evaluating symptoms. When we discuss heart attacks, many people focus primarily on chest pain, but it's very important to recognize that the discomfort or pain related to a heart attack can extend beyond the chest. This is often referred to as referred pain, and understanding it is crucial for timely diagnosis and treatment. The upper body has a network of nerves that can send signals of distress to various regions, so the pain from the heart can manifest in areas like the arms, back, neck, jaw, and even the stomach. Knowing this can help you or someone you care about recognize a heart attack sooner. One of the most common sites for this referred pain is the arms, especially the left arm. The reason is anatomical and neurological. The heart and the left arm share nerve pathways that enter the spinal cord at similar levels. When the heart experiences ischemia or a lack of oxygen due to reduced blood flow, the nerves transmit pain signals to the brain that can be perceived as originating from the arm. This is why many patients describe a burning, aching, or heavy sensation down the left arm, sometimes extending to the fingers. It's important to note that pain can occur in the right arm as well, though it's less common. Pain may also radiate to the back, particularly the upper back between the shoulder blades. This type of discomfort might feel like a deep ache or pressure and can sometimes be mistaken for muscle strain or poor posture. But in the context of heart symptoms, especially when combined with other signs such as chest discomfort or shortness of breath, upper back pain should raise suspicion for cardiac ischemia. The neck and jaw are other key areas where heart attack pain can present. Jaw pain is particularly significant because it might be dismissed as a dental issue or temporomandibular joint (TMJ) disorder. However, ischemic heart pain can stimulate nerves that supply sensation to the jaw, producing discomfort or even sharp pain. This symptom can be especially prominent in women who sometimes experience less classic chest pain and more vague discomfort in the jaw or throat. The pain may be constant or intermittent and is usually not related to eating or jaw movement, which can help distinguish it from dental or joint causes. Sometimes people report pain or discomfort in the upper stomach or epigastric region during a heart attack. This can mimic indigestion or acid reflux, which leads to delays in seeking emergency care. The reason behind this is again referred pain from the heart, mediated by shared pathways with the stomach area. This type of pain is often accompanied by other symptoms such as nausea or vomiting, which can further confuse the diagnosis. In fact, many patients initially think they have a stomach problem rather than a cardiac event, which emphasizes the need for education and awareness. Understanding why pain is referred to these various areas lies in the physiology of the nervous system. The heart's pain fibers enter the spinal cord at the levels of T1 through T5 spinal nerves, which also receive input from the skin and muscles of the chest, shoulders, arms, neck, and upper back. Because of this overlap, the brain can misinterpret the origin of pain signals, perceiving them in these other regions instead of the heart itself. This neurological phenomenon explains the diverse presentation of heart attack symptoms and is why medical professionals always ask about pain in these areas during assessment. This variability in symptom location makes the diagnosis of heart attacks particularly challenging. Not everyone presents with the classic crushing chest pain. Some patients might experience only upper back discomfort, jaw pain, or arm heaviness, sometimes without any chest discomfort at all. This atypical presentation is more common in certain populations such as women, older adults, and people with diabetes. These groups may have altered pain perception or nerve function, leading to less obvious symptoms. As a result, they are at higher risk for delayed diagnosis and worse outcomes. It's essential for both patients and healthcare providers to maintain a high index of suspicion when faced with unexplained pain in these upper body regions, especially if it is new, persistent, or accompanied by other symptoms like shortness of breath, sweating, dizziness, or nausea. Early recognition and prompt treatment are critical to limit heart muscle damage and improve survival rates. When someone reports pain radiating to these areas, especially in the context of exertion or emotional stress, immediate evaluation is warranted. Emergency services should be contacted without delay, and the person should avoid physical activity until assessed by medical professionals. Time is muscle. The longer the heart muscle is deprived of oxygen, the greater the injury. In summary, pain in other areas of the upper body is a vital clue in identifying heart attacks. It reminds us that the heart's distress is not confined to the chest but can express itself in several ways. Awareness of this can empower you to act quickly and seek help, potentially saving a life. Recognizing these symptoms and understanding their physiological basis not only improves patient outcomes but also enhances public health awareness. Shortness of breath is a symptom that many people experience, but when it occurs in the context of a heart attack, it is particularly important to understand why it happens and what it means. It's not just about feeling out of breath after climbing a flight of stairs or doing strenuous exercise. This type of breathlessness can be a warning sign that the heart is struggling and requires immediate attention. The heart's primary role is to pump oxygen-rich blood to the body, ensuring that every cell receives the oxygen it needs to function. When the heart muscle is compromised, such as during a heart attack, its ability to pump effectively diminishes. This leads to a cascade of physiological changes that contribute to the sensation of shortness of breath. When an artery supplying the heart is blocked or narrowed, part of the heart muscle becomes ischemic, meaning it's starved of oxygen. This damage impairs the heart's pumping capacity, which means less blood is being circulated efficiently. When the heart cannot pump blood forward properly, blood begins to back up in the lungs, causing fluid to accumulate, a condition known as pulmonary congestion or pulmonary edema. This fluid buildup interferes with the lungs' ability to exchange oxygen and carbon dioxide effectively, resulting in a feeling of breathlessness. Patients may describe this sensation in several ways. Some say they feel like they can't take a deep enough breath. Others experience a tightness in the chest or a sense of suffocation. This is not simply normal shortness of breath after exertion, but rather a distressing symptom that may occur at rest or with minimal activity. It can develop gradually or suddenly, and is often accompanied by other signs such as coughing, wheezing, or a feeling of anxiety. Shortness of breath during a heart attack can also arise from other mechanisms. For example, if the heart's left ventricle, the main pumping chamber, is damaged, it may dilate and weaken, leading to heart failure. This further impairs circulation and worsens pulmonary congestion. Additionally, arrhythmias or abnormal heart rhythms can reduce cardiac output, exacerbating breathlessness. Recognizing this symptom is critical because it often precedes or accompanies chest pain, but can also be the sole presenting feature, especially in women and older adults. Some patients may not experience classic chest pain, but will have unexplained shortness of breath, fatigue, or weakness. These atypical presentations underscore the importance of not dismissing breathlessness, particularly if it is new, severe, or associated with other concerning signs. It's also worth mentioning that shortness of breath can be caused by a variety of non-cardiac conditions such as lung diseases, like asthma, chronic obstructive pulmonary disease, COPD, pneumonia, or even anxiety disorders. However, in the setting of suspected heart disease, it should always prompt urgent evaluation to rule out a cardiac cause. From a physiological standpoint, the sensation of shortness of breath involves complex interactions between the lungs, heart, nervous system, and respiratory muscles. When the lungs are congested, the oxygen level in the blood drops, stimulating receptors that signal the brain's respiratory centers to increase the rate and depth of breathing. This effort to compensate can feel exhausting and may not fully relieve the sensation of breathlessness. Patients experiencing shortness of breath should seek immediate medical care, especially if the symptom is sudden, severe, or accompanied by chest discomfort, sweating, nausea, dizziness, or palpitations. Timely diagnosis and intervention can prevent further heart damage and improve survival. In emergency settings, treatment may involve oxygen supplementation, medications to reduce fluid overload, improve heart function, and restore blood flow through blocked arteries. Long-term management includes lifestyle modifications, medications, and sometimes procedures to address the underlying heart condition. In summary, shortness of breath is a significant symptom in the context of heart disease, reflecting the heart's compromised ability to maintain adequate circulation. Understanding this helps empower patients and caregivers to recognize danger signs and seek help promptly. Awareness and education are key components in reducing delays in treatment and improving outcomes. When we consider the symptoms of a heart attack, many people naturally focus on chest pain or shortness of breath. However, there are other important, sometimes less obvious symptoms that deserve our attention, namely cold sweats, nausea, and lightheadedness. These signs might seem unrelated at first glance, but they are very much connected to the heart's distress during an ischemic event, and recognizing them can be vital in saving a life. Cold sweat, or diaphoresis, is a symptom where a person suddenly breaks out into a clammy, cold sweat that isn't related to heat or exertion. This response is mediated by the autonomic nervous system, which regulates many involuntary body functions. During a heart attack, the sympathetic nervous system, the part responsible for the fight or flight response, is activated. This activation causes the release of stress hormones like adrenaline, which prepare the body to respond to danger. One of the effects of this adrenaline surge is increased sweating, even if the environment is cool and the person is at rest. This cold sweat is different from the sweat you produce during exercise or hot weather. It often feels clammy, cold, and uncomfortable. You might notice your clothes sticking to your skin or a sudden chill despite feeling anxious or unwell. This symptom is a warning sign that the body is under significant stress, and it frequently accompanies other symptoms like chest pain or shortness of breath. Nausea during a heart attack is another symptom that is often overlooked or misattributed. People might think they have an upset stomach, food poisoning, or a viral illness, but nausea can be a direct consequence of cardiac ischemia. The heart and gastrointestinal system are closely linked via the autonomic nervous system. When the heart is deprived of oxygen, signals are sent to the brainstem, which can trigger nausea and sometimes vomiting. This connection explains why many patients report feeling sick to their stomach or actually vomit during a heart attack. It's especially important to note that nausea without obvious chest pain can sometimes be the only symptom experienced, particularly in women and older adults. This atypical presentation can lead to delays in seeking medical help because the symptoms seem unrelated to the heart. Understanding that nausea can be a cardiac symptom empowers patients and caregivers to recognize its significance. Lightheadedness, or feeling faint and dizzy, is another critical symptom to understand. During a heart attack, the heart's ability to pump blood efficiently is compromised. This can lead to a drop in blood pressure or an irregular heart rhythm, both of which reduce blood flow to the brain. When the brain doesn't get enough oxygenated blood, it reacts by producing sensations of dizziness or near fainting. This lightheadedness can be alarming and is often accompanied by weakness or fatigue. It can occur suddenly or progressively worsen. Sometimes it precedes fainting or syncope, which is a complete loss of consciousness. These symptoms are particularly dangerous because they can lead to falls or injuries, and may indicate serious underlying cardiac problems like arrhythmias. From a physiological standpoint, these symptoms are interconnected by the body's response to stress and impaired cardiac function. The autonomic nervous system plays a central role, coordinating the heart rate, blood vessel tone, sweating, and gastrointestinal function. During a heart attack, this system becomes highly active, sometimes in an unbalanced way, leading to the cluster of symptoms we're discussing. It's essential for everyone to realize that cold sweat, nausea, and lightheadedness should never be ignored, especially if they occur suddenly and are accompanied by other symptoms like chest discomfort, shortness of breath, or pain radiating to other parts of the body. Immediate medical evaluation is crucial because these signs can herald a life-threatening event. In the emergency setting, healthcare providers use these symptoms alongside diagnostic tools like EKGs and blood tests to identify heart attacks quickly. Early intervention with medications, oxygen, and procedures to restore blood flow significantly improves outcomes. On a personal level, understanding these symptoms helps empower patients to seek help promptly, rather than waiting or attributing these sensations to less serious causes. Education about the varied presentations of heart attacks, including these non-classical symptoms, can save lives by reducing delays in treatment. Remember, heart attacks do not always present with dramatic or textbook symptoms. They can be subtle and varied, which is why awareness of signs like cold sweats, nausea, and lightheadedness is so important. This knowledge helps individuals act decisively in moments that truly matter. Fatigue and weakness are symptoms that many people experience from time to time, often attributed to stress, lack of sleep, or general tiredness. However, when these symptoms occur in the context of heart disease, especially a heart attack, they take on a much more serious meaning. Recognizing fatigue and weakness as possible warning signs of cardiac issues is crucial because they often precede more dramatic symptoms, and sometimes they may be the only clues that something is wrong. The heart's role in the body is to pump oxygen-rich blood to every organ and tissue. When the heart is compromised, either because of blocked arteries or muscle damage during a heart attack, its ability to meet the body's oxygen demands diminishes. This reduction in blood flow means that the muscles and organs receive less oxygen and nutrients than they need, leading to a general sense of exhaustion or weakness. This fatigue is not the ordinary tiredness you might feel after a busy day. It's often described as overwhelming, persistent, and unexplained. Patients may report feeling unusually tired even after resting or sleeping well. This kind of fatigue can interfere with daily activities, making it difficult to perform routine tasks like walking short distances, climbing stairs, or even getting out of bed. Weakness may accompany this fatigue, manifesting as a loss of strength in the arms or legs, or a general sense of heaviness. Physiologically, this fatigue results from the heart's impaired ability to circulate blood efficiently. When cardiac output drops, the body's tissues switch to less efficient means of producing energy, often relying on anaerobic metabolism, which produces lactic acid and contributes to muscle fatigue. Additionally, reduced blood flow to the brain can impair cognitive function, making concentration and mental tasks feel more difficult, which patients might describe as brain fog. Fatigue and weakness are particularly important symptoms because they can be subtle and easy to overlook. Unlike chest pain or sudden shortness of breath, these symptoms may develop gradually over days or weeks, especially in women and older adults. In fact, women are more likely than men to present with fatigue and weakness as the predominant symptoms of a heart attack, which sometimes leads to delays in diagnosis. Another contributing factor to fatigue during a heart attack is the body's systemic response to stress. When the heart is under distress, the sympathetic nervous system activates, releasing stress hormones such as adrenaline and cortisol. While these hormones initially help the body cope by increasing heart rate and blood pressure, prolonged activation leads to exhaustion and muscle breakdown, compounding feelings of weakness. Moreover, fatigue and weakness during cardiac events can be linked to other complications such as anemia, which reduces the blood's oxygen carrying capacity, or electrolyte imbalances that affect muscle and nerve function. These conditions often coexist with heart disease and worsen symptoms. Patients experiencing unexplained fatigue and weakness should be vigilant, especially if these symptoms are new, persistent, or worsening. They should be aware of other accompanying signs like shortness of breath, dizziness, or chest discomfort. Early recognition and timely medical evaluation can identify underlying cardiac causes and lead to interventions that prevent further heart damage. From a clinical perspective, healthcare providers consider fatigue and weakness alongside other symptoms during patient evaluation. These symptoms often prompt further diagnostic testing, including blood tests, to assess cardiac enzymes, EKGs to detect electrical abnormalities, and imaging studies to evaluate heart function. Treatment strategies for fatigue and weakness related to heart disease focus on improving cardiac output and managing underlying causes. This may include medications to open blocked arteries, control blood pressure, or treat arrhythmias. Lifestyle modifications such as regular exercise, a heart-healthy diet, and stress management also play a critical role in improving symptoms over time. Understanding the significance of fatigue and weakness empowers patients and caregivers to act promptly. These symptoms are not just signs of aging or stress, they can be early indicators of a serious cardiac event. Educating the public about this can lead to earlier diagnosis, better management, and ultimately, improved outcomes. In summary, fatigue and weakness in the context of heart disease are more than just feeling tired. They are manifestations of the heart's struggle to maintain adequate circulation and oxygen delivery. Recognizing these symptoms and seeking timely medical care can make a profound difference in preventing heart damage and saving lives. When we think about heart attacks, many people imagine a classic scenario: sudden, crushing chest pain, sweating, and difficulty breathing. While this is certainly a common presentation, the reality is far more complex. Heart attacks can present in many different ways, and these differences in symptoms can have significant implications for timely diagnosis and treatment. Understanding these variations is critical for both patients and healthcare providers because it affects how quickly someone seeks help and how promptly care is delivered. One of the most important factors contributing to differences in presentation is biological sex. Men and women often experience heart attacks differently. Men typically present with the classic symptoms: intense chest pain, often described as a heavy pressure or squeezing sensation in the center of the chest, sometimes radiating to the left arm or jaw. This classic presentation has been widely publicized and is well recognized by the general public and medical professionals alike. Women, on the other hand, frequently have what we call atypical presentations. They might not experience the hallmark chest pain or may describe it differently, such as a sensation of tightness, pressure, or discomfort, rather than outright pain. Women are also more likely to report additional symptoms that can be mistaken for other conditions. These include shortness of breath, nausea, vomiting, fatigue, indigestion, and pain in less typical locations like the back, neck, or jaw. Because these symptoms are less specific, they can be more easily overlooked or attributed to less serious causes, which unfortunately leads to delays in diagnosis and treatment. Age is another critical factor influencing how heart attacks present. Older adults often have less typical symptoms compared to younger individuals. They may experience more subtle signs such as generalized weakness, confusion, or shortness of breath without significant chest discomfort. This atypical presentation is partly due to changes in pain perception with aging and the presence of multiple chronic illnesses that can mask or mimic heart attack symptoms. For example, a person with chronic lung disease or arthritis might attribute new symptoms to their existing conditions, delaying seeking care. People with diabetes represent another group with unique presentations. Diabetes can cause nerve damage, known as diabetic neuropathy, which affects how pain signals are transmitted. As a result, many diabetic patients have silent or painless heart attacks. They may not feel chest pain at all, even though significant damage is occurring in their heart muscle. Instead, they might experience vague symptoms such as fatigue, shortness of breath, or even dizziness. This lack of classic pain makes it particularly challenging to identify heart attacks promptly in diabetic individuals. The variability in presentation underscores the importance of a thorough clinical evaluation when patients report symptoms that could suggest heart disease. Healthcare providers are trained to ask detailed questions about the quality, location, duration, and triggers of symptoms. They also consider risk factors such as age, sex, diabetes, hypertension, and smoking history to assess the likelihood of cardiac events. It's also important to recognize that cultural and social factors can influence how symptoms are reported and perceived. Some patients may downplay or minimize their symptoms due to fear, stigma, or lack of awareness. Others might not have access to healthcare or may face language barriers that complicate communication. These factors can contribute to disparities in diagnosis and treatment of heart attacks across different populations. The concept of differences in presentation extends beyond just recognizing symptoms. It also highlights the need for public education and awareness campaigns tailored to diverse populations. For example, many heart health initiatives now emphasize that women's symptoms may differ from men's and encourage women to seek prompt care, even if their symptoms seem atypical. Similarly, educating diabetic patients about the possibility of silent heart attacks can improve vigilance and early detection. From a physiological perspective, the differences in symptom presentation can be explained by variations in nerve distribution, hormonal influences, and individual differences in pain tolerance. For instance, estrogen in premenopausal women may affect how pain signals are processed and perceived. Neuropathy in diabetics alters nerve function. These factors all contribute to the diverse ways heart attacks manifest clinically. Recognizing these differences can save lives. Early treatment of heart attacks significantly improves outcomes, reducing heart muscle damage and the risk of complications. When symptoms are atypical, delays in seeking care can lead to worse prognoses. Therefore, both the public and healthcare professionals must maintain a high index of suspicion and consider heart disease even when symptoms are not classic. Ultimately, the variability in how heart attacks present reminds us that medicine is not one-size-fits-all. Individualized assessment, awareness of risk factors, and understanding patient-specific presentations are key to timely diagnosis and effective treatment. Empowering patients to recognize a broad spectrum of possible symptoms can lead to faster intervention and better health outcomes. Recognizing the signs of a heart attack early can save lives. If you or someone around you experiences these symptoms, don't wait, call emergency services immediately. Remember, heart attacks don't always present with dramatic pain, and every minute counts. Stay informed, stay prepared, and empower yourself with knowledge. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more health insights. Stay healthy, and take care.